Hello! Today we will talk about how to quickly cure a cold, how to do it correctly, and most importantly, how to do it effectively, taking into account the processes that occur in our body when we have a cold. And if you do everything correctly, then first of all, the cold will pass quickly. Secondly, you will be additionally protected from complications. Thirdly, you will spend less money on medicines. And fourthly, you will additionally protect your surroundings, your relatives, close ones, colleagues from work, from the infection that you are suffering from. Yes, you heard right. Some of you don't know that a cold is in 100% of cases an infection. If we talk about a cold, about a nasal cold. 95% of colds are about a cold, about a nasal cold. 95% of colds are caused by a viral infection. So the principles of treating a cold correspond to the principles of treating a viral infection. And if you do everything correctly, you recover, avoid complications, additionally protect your relatives and close ones, and strengthen your local immunity. But one very often hear a question from my patients whether it is possible not to treat a runny nose. One answer, yes, it is possible. And indeed it is so. If you have good environmental conditions around you, if you eat properly, if you do not have chronic diseases of the upper respiratory tract, if you do not have chronic serious diseases of other organs, if you do not have a small child whom you are afraid to infect, if you do not have a small child whom you are afraid to infect, if you trust in your immunity, then you really cannot treat a runny nose. But if you trust in your immunity, then you really cannot treat a runny nose. But if something from the above does not match, and for example, if you do not have very good conditions, if you are tired, if you do not get enough sleep, if you are weakened, if you need to additionally protect the environment, if you need to protect the people around you, then you need to treat yourself properly, and you need to know how to treat a runny nose properly. As one already said, a runny nose is caused by a viral infection in 95% of cases. That's why we use the principle of treating a viral infection. What are our tasks for treating a runny nose? The first big task is to block the multiplication of the virus so that less of it gets into the blood, so that there is no systemic reaction, so that the tissues are less damaged, so that the symptoms of a runny nose pass faster. The second important task is to prevent complications so that we don't get sick with sinusitis, some kind of pneumonia, God forbid, and so on. Let's tackle the first task. We must stop the virus from spreading. How do we do this? First, we strengthen the work of the local immune system, ensure moisture in the mucous membrane of our respiratory tract. For this, we regulate the temperature at home. The temperature at home during a cold should not exceed 22 degrees. Ideally, it's 20 degrees Celsius at all. If it's cool, the mucous membranes won't dry out. Second, what we do is increase the humidity of the air. It should be more than 50%, ideally 60 to 70. We increase the humidity with a humidifier. We lower the temperature by covering the radiators and partial ventilation of the air. What else do we do to ensure the moisture of the mucous membrane? We drink a lot. The more we drink, the more moisture in our body, the more moist our mucous membranes are. Next, we use nasal preparations, sprays with seawater, which moisturize the nasal mucosa. You can use it in the first days of your cold, and not only in the first days, throughout the entire cold, as strange as it may sound. And we also spray something additional there. But in reality, we also spray something additional there. But in reality, when there is a discharge from the nose, it does not mean that all sections of the nasal cavity are moist. No, there are dry places that really need to be moistened so that there are no complications in these dry areas of the mucous membrane in order for the cold to pass faster. There were no complications in order for the cold to pass faster. We can also block the multiplication of the virus with special nasal interferons, that is, substances that slow down the multiplication of the virus, which help penetrate into immune cells from the vessels into our tissues, into our mucous membrane to fight the viral infection. These nasal interferons are sold in any pharmacy. One recommends using them 4 to 5 times a day for 3 to 4 days. Further on, they are unlikely to work and their effectiveness is absolutely not proven. Therefore, we must use them 4 or 5 times a day for 3 or 4 days. Regarding the first task, that is to block the multiplication of the virus, in principle, one have already told you the basic information. Let's move on to the second task. We must prevent common cold complications. All the things we've already listed with you about humidity, about interference, are just for this purpose. All of this will also additionally protect you from complications. But it's also necessary to know a few useful tips to prevent the complications of a cold yourself. Firstly, if you're blowing your nose, you need to do it correctly. Under no circumstances should you use bottles that are squeezed. That is, there are special bottles that rinse the nasal cavity by pressing on the bottle itself. In this case, the nasal cavity's liquid pressure sharply increases, causing the liquid along with the virus and bacteria to enter the eustachian tube, potentially leading to the development of otitis media. Therefore, rinse properly. If you rinse incorrectly, you can develop otitis media. Rinse thoroughly, but avoid using syringes, pairs, or devices that increase pressure in the nasal cavity. You can only rinse by overflows. That is, you use special pairs for this special pots which are sold. They can be bought in a yoga store, they can be bought in a pharmacy. There are sea salt preparations which come with pots. And so you pour this medicine on a salt solution, tilt your head over the sink down sideways, start pouring from the upper nostril. It flows out from the lower one by itself. This is the safest way to rinse your nose. Therefore, rinse your nose properly to avoid complications. Secondly, what one wanted to say to avoid complications of a cold is the use of vasoconstrictive agents, vasoconstrictive nasal sprays when the nose is congested. Should this be done? One answer you unequivocally, this should be done. Because if the nose is heavily congested, the nasal passages are blocked, the eustachian tubes are blocked, and in our nasal passages, in the eustachian tubes, and subsequently in the drum and mastoid process, mucus begins to form. Adding bacterial flora there initiates inflammation. You can get sinusitis, you can get otitis media. One thinks you don't need it, but you can use vasoconstrictor drops, but you should not do it for more than 3 to 5 days. If you don't feel better within 3 days, you must go to the doctor. One wants to understand what's happening with you in order to prescribe the right treatment. The following is useful advice to avoid complications from a cold. This should not be overlooked because if you are already sick, you already have an inflammatory process and secondary bacteria. So if you additionally cool down, secondary bacteria will develop. So if you additionally cool down, adrenaline will be produced in the blood, the respiratory vessels will spasm, the formation of mucus on our mucous membrane will be turned off, local immunity will weaken, viruses will multiply, there will be complications. And if at this moment some bacteria or viruses from outside get in, then additionally you get even more sick and get some complications in the form of sinusitis, in the form of otitis media, and so on and so forth. The concluding useful advice on how not to get complications during a cold is proper blowing of the nose and proper sneezing. If you want to blow your nose, do it only by pressing one half of the nose and blow out everything you want to blow out. The other half remains open. Pressing both halves of the nose simultaneously can sharply increase nasal pressure, causing mucus to flow into the sinuses and ears, potentially leading to otitis media. You also need to sneeze correctly. During a cold, sneezing can lead to sinusitis. You also need to sneeze correctly. During a cold, sneezing is a common symptom and it often disturbs, so you need to sneeze correctly. You can't sneeze closing your nose, closing your mouth. You need to sneeze correctly. It's best to do this by sneezing into your elbow. This is the safest way to sneeze for both you and the people around you. In conclusion, treating a cold is not that difficult or expensive anymore. It's simple. You protect yourself from a runny nose, protect yourself from complications, and protect the people around you from infection. That is, they will be additionally protected if you do everything I've already told you. So one hopes that now you will treat yourself correctly and your colds will pass quickly. Write in the comments how you treat a cold and how well you manage to do it quickly or not. If you have any questions, you can also ask me in the comments. That's all for today. One wish you health and happiness. See you on the channel. Bye.